6 o'clock, yeah. Okay. And Katja, let's wait a few minutes and then we start then, yeah. Okay.
Spotlight already everyone, all our panelists, or later?
Why not, huh? Yeah, I think good idea, yeah.
Okay, just a second.
Dear Katja, maybe we can wait a few minutes because a lot of colleagues write that they have some difficulties to come in the room. So maybe we should wait.
Sure. We are waiting. Just let me.
Okay.
Not everyone.
Hey, Professor Pritz.
Yeah, I'm doing. There are a lot of people joining at the same time, so sometimes it could be difficulties with connecting. So
Wonderful.
now I'm here, yes.
What a beautiful panel to see all of you. Wonderful.
Thank you for orchestrating this, Remy. Thank you so much.
If you allow, we just wait a few minutes, 2 or 3 minutes, and then we can, I think,
Sure.
start then, yeah. So. Fritz, wollen Sie den Nachnamen noch reintragen bei sich oder nicht?
Ja.
Bei dem Namen, da steht
Oder
halt nur
können
Alfred.
Sie es eintragen?
Nee, ich weiß nicht. Katja, can we change, can you add the name of the family name of Mr. Pritz?
Yes, I can.
Yeah,
Just a
Alfred
second.
Pritz then, yeah, okay. Katja can do all these things then, yeah, she can change the identity of us, yeah.
I can control everything here.
Okay, thank
Just
you.
this 90 minutes.
Maybe to the panelists, you just stay where you are. You don't need to go to any translation thing. Yeah, so you just stay where you are. Okay, Katja, let's start then, yeah.
No, Wojtek is not necessary this time because there will be only chat questions.
Mhm. So, dear colleagues and friends, yeah, good morning, good afternoon, good evening. Yeah, we start from California, we go to Europe, and we go to China. So, really, welcome everybody. My name is Hamid Pezeshkian, and I'm presently the president of the World Association of Positive and Transcultural Psychotherapy. and have the great honor and pleasure to welcome you to this very special meeting. It is really a global roundtable, and we want to discuss together the future of psychotherapy. And I think it's not just by chance that positive psychotherapy is organizing that, because the idea to be future-oriented and to see how different cultures can work together, what can we learn from each other, is really in the DNA of this method for the last 50 years. But today we want to not only listen, we want to think together, because psychotherapy is changing. It's influenced by new technology, new developments of science, new cultural aspects, and especially the needs of humanity are changing. While we are speaking now today here, we know in many parts of the world wars going on. Many of them you don't even listen or don't hear in the news. There are many wars going on. I think it's 50 or so parallelly. And so the question is not only where are we going with psychotherapy, but also who do we want to be as a profession, and how can we shape the future of psychotherapy, and what can we contribute to the society in large. I'm very grateful, really deeply grateful to our very distinguished panelists for joining us today. Actually, I would need 1 hour to introduce each one of them, and still it would be not enough. And I have just one minute per person, so just very briefly, let me introduce. What they have in common, all 4 you will see today, and listen, they are all, you could say, ambassadors of psychotherapy. Each one of them, on his or her way, is really an ambassador of psychotherapy, and they have really shaped our field, our profession, and also developed it much further. And each one of them is really a true leader of psychotherapy. So I think therefore it's most fascinating to have them all together here. Let me start with Mrs. Gabriela Hum from Romania. Ms. Hum is a psychologist and psychotherapist, and one of the, you can say, leaders of positive psychotherapy. Currently, she's the president of the Romanian Association of Positive Psychotherapy. And for more than, I think, 20 years, she has been on the international board of positive psychotherapy. Her main field is training, educating the next generation of psychotherapists. I know, Gabi, you came back yesterday from Mongolia, where you have been in a training. It's a new country where we are trying to do something. And so we're very much looking forward to your insights, really, from training from so many countries where you have been. Thank you very much for being part of this panel.
Thank you for the invitation, Hamid.
Thank you. Professor Alfred Pritz comes from Vienna, Austria. And I think everybody in Europe, at least, who's a little bit open-minded, knows Alfred Pritz then. And I think without exaggeration, we can say, without Professor Pritz, psychotherapy, at least in Europe, would have developed in another way. God knows in which way, but in another way then, He is known as the founder and for many, many years, the General Secretary of the European Association of Psychotherapy. I just have to tell you the European Certificate of Psychotherapy, then everybody knows what I mean with that. Then he's the president and founder of the World Council of Psychotherapy. And he founded, I think it's the first private psychotherapy university in the world, the Sigmund Freud University, which has its main quarter in Vienna, in Austria. I know you, Professor Pritz, I think yesterday night you also came back from Uzbekistan. So it's also traveling a lot as an ambassador for our method. And thank you very, very much for being here. And I think colleagues will be very excited to hear and see you. Professor César Alfonso joins us from New York in the United States. I think it's about how lunchtime in your place then, huh? It's about midday, yeah. So really, thank you very much. Professor Alfonso is a psychiatrist and also psychoanalyst, as Professor Pritz is also. He is the president of the World Federation for Psychotherapy. This is the oldest psychotherapy, international psychotherapy organization in the world. The first president was Carl Gustav Jung. So you see, it's really going back to the early roots. Professor Alfonso is also a clinical professor of psychiatry at Columbia University in New York. He's visiting professor in several universities, many of them like in Asia, like in Philippines, and so on. Then, and he tries, of course, to see how can we develop psychotherapy worldwide, also further than bearing in mind the things we have in common and the things we differ. Thank you very much, Professor Alfonso, to be here. I think it's a pleasure to have you here. And it's a great honor and pleasure to have Professor Dilip Jesti here from California, United States. It's 6 o'clock in the morning there. Professor Jesti, thank you very much, really, for joining that. So you have the farthest way, so to say, to come here. Professor Jesti is known to many of us as the founder of positive psychiatry. So when we have Nosat Pezeshkian, Martin Seligman, and we have Dilip Jesti, yeah, for these three positive approaches. He was the former president of the American Psychiatric Association, is now the president-elect of the World Federation for Psychotherapy, and has been very engaged in the last years in the aspect of social determinants, yeah, and I think mental health of elderly people and in general then, and many, many other things. Professor Jesti, it's a great pleasure to have you here. Thank you very much.
Thank you very much.
Please forgive me that I can't go deeper in the introduction, but so dear friends, what are we planning today? We have a little bit time. I mean, we would need a whole day, but we have 90 minutes and 10 have passed already. We want to discuss, I thought maybe 3, 4 main topics. And then it would be nice if each one of you could share something to that then. I think that would be for the audience more interesting. If possible, like a short feedback, I don't know, 2-3 minutes, something like that then, yeah. And then so we can keep this on, but you are free to share whatever you feel is important for our colleagues from different places of the world. And for the audience, there will be the opportunity later in about 1 hour to take 3-4 questions from you. Yeah, maybe you can share them then with the host and they will select and see which question we can discuss maybe in the plan. I think that's it. Well, the first topic I want to discuss together is the changing needs in mental health. I mean, our clients have changed, society is changing. I mean, just to take the last 10 years, not to speak about the last 30, 40 years, we have an increase of mental disorders. The families have problems, the youth have problems, the children, and many other things, trauma, war. So what would you say, how has psychotherapy changed the last maybe decade? And how should it develop now in order to stay relevant, impactful, accessible then, yeah? So what has changed? What do we have to include in our work and so on then? And Professor Jesti, I thought maybe you could start because I know you are very much in this aspect that we should not speak only about mental disorders, we should speak about mental health. So maybe I thought this would be a good, maybe you could start and then the colleagues can share also. Please.
Thank you, Professor Pezeshkian, for organizing this wonderful conference. I'm just delighted and honored to be here. Your point is very well taken. Things are changing a lot from the mental health perspective. There is thought to be a behavioral pandemic of loneliness. And this is something that has been going on for the last 20, 25 years. In the US, for example, the number of deaths increased before COVID, and that was really related to loneliness. There are ministries of loneliness in the UK and Japan, and this is becoming a major problem. Obviously, it's a mental health problem, but at the public health level. And we really need to do something about that. In the sense, right now, actually, if you look at what is happening in the news, in the social media, people are getting more angry, more depressed, and the whole mental well-being level is going down. And really, as psychiatrists, psychologists, it's our job to help that. And that's why this kind of a meeting is really very important, looking at where psychotherapy should be going in near future.
Thank you very much. Thank you very much, Dan. Yeah.
May I add something here?
Yes, of course.
As I know, in 2024, World Health Organization presented statistics about mental disorders. And in Europe, they said that 46-47% of the adult population had during 2024 at least one problem of mental disorder, and that's why they name 2025 and 2026 years of mental health, and they try to develop a lot of programs for mental health. The interesting thing is that from these 46% of people who had difficulties, mental difficulties, only 50 or a little bit more than 50%, they had opportunity to ask for help. Because the specialist in mental health, at least in Europe, seems to be not enough. So this is what I wanted to add to what Professor Justice said, that patients are more and more, and we as specialists, the number of specialists is decrease.
Thank you very much. Very important point, because that brings us later then to the issue, whom do we have to train? Because psychiatrists, psychotherapists are not enough worldwide. We were just in a conference. They said you have to, they are training in some countries of Africa, the hairdressers, because people go there, especially the ladies, and they spend not like us 5 minutes, but they spend several hours there. So the hairdressers have to be prepared to deal with some of these issues. Maybe
in Ethiopia,
yeah.
sorry, Hamid, in Ethiopia, our colleague said that the oldest ladies in the tribes, they are educated to become a kind of counselors in their villages.
Thank you very much. Professor Alfonso, Professor Pritz, some ideas, please.
Yes, if I may, thank you so much for organizing this wonderful panel. To follow up on what Dilip and Gabby mentioned, but I think part of the awareness of the changing needs in mental health is the awareness that our understanding of mental health and our approach to mental health should go, like you mentioned, Hamid, beyond psychopathology, beyond the psychiatric and psychology, nosology paradigm. We need to think of the salutary effects of psychotherapy that go beyond symptomatic reduction, because otherwise we'll be going around in circle. Take, for example, what has happened to the prevalence of suicide in the last 75 years. It hasn't changed much with all of our advances, with all of our outreach. And if we look at the original studies to try to fix the problem of suicide, it all started in the social sciences. Even before sociology was created as a field, social scientists were looking at the problem of suicide from a cultural perspective, from a social perspective, from an anthropological perspective. So I think that we need to, in our fields in mental health as professionals, go beyond our niche of the mental health professions and begin to collaborate with sociologists and anthropologists and people in the community and linguists and people in the humanities, etc., to have, and politicians, of course, to have more of an impact in terms of improving the overall mental health of populations.
Thank you very much, because it seems that much too long we have been in the therapy room alone with the patient for 1 hour per week, maybe over several years. But outside of that room, many things are happening actually then, yeah. Yeah, thank you very much. Professor Pritz, maybe some thoughts you have on what has to change now, mental health, and how psychotherapy should develop.
I figured out 4 points. The first point is, since many years, since Freudian times, there's one endeavor that is to raise the quality of psychotherapy, because it's such a wide field with beginners, with experienced psychotherapists, with healers from different traditions. And so the effort is to raise the quality control or quality achievements in psychotherapy. Associations do it with specific curricula, but also the state does it. We have in Europe more than 10 laws that regulate psychotherapy. And astonishingly enough, Germany has since 1919 a law for psychotherapists, which are not asking for medical psychology or other basic professions, but you can study psychotherapy on the bachelor, master, and later on not yet implemented, except our university, a doctorate in psychotherapy. So the education will continue in this context, and more laws are coming into existence in the next few weeks, even months. A new law in Slovenia on the regulation of psychotherapy. And what is interesting is the fight to monopolize psychotherapy for medical staff or for psychology did fail. All laws in Europe which are existing now have several possibility of entrance to the training. So this is basically structurally really done. But in many countries, there is not enough education in psychotherapy, still worldwide. Second point or third point is, as the Professor Jeste already mentioned, the question of social responsibility. The question is, are the states have empowerment enough to pay for psychotherapy? Or should it be still a private enterprise of patients to pay it? And we have a tendency that the state takes over for at least an amount of payment. I don't know about the current status in the States, but in Europe, many countries pay already psychotherapy. And the last one, a challenge for the future we deal a lot with, is artificial intelligence. How can we use artificial intelligence in the work of psychotherapists? There's a big fear that artificial intelligence could replace psychotherapists. And there's one funny anecdote of Mr. Weizenbaum. Maybe you have heard from him. He was one of the pioneers in psychotherapy, no, in artificial intelligence, and he tried to substitute a machine who uses the principles of Carl Rogers in reformulating topics, what the patient says, and he comes to an end when the patient is silent. And then the machine says, "You're repeating yourself." So, and this was the end of Weizenbaum's endeavor. But now we have totally different situations, as there are so many work done to be much more sophisticated in the machinery of communication. And I think that is a major topic, not our topic. We are too old for that. And we are in the beginning of artificial intelligence. In 100 years, there will be, I think, a significant different picture of it. So these are my points.
Yeah, and even you didn't know that, which is the 4 topics I want to present you. That's a good bridge to the next huge area, which is actually the whole question about innovation in psychotherapy and
Yes.
and integration. And maybe you could share some of your ideas, really. What are the most important innovations you think shaping psychotherapy? And what should we embrace and where should we be careful? I mean, it could be this whole digital therapy, then the aspects of, we have neuroscience, then somatic approaches, online therapy, the psychedelic assisted therapy, so with drugs, and artificial intelligence and so on. Then maybe Professor Alfonso, you want to start, because I know you are very much in this very integrative concept. I think you discussed that also recently in a conference in the Philippines you had. I thought this might be interesting also. Then what should be the innovation, maybe what should we integrate and maybe what not?
Okay, thank you, Hamid, for allowing me to address this first. I am cautiously optimistic that all of these advances will enhance our field rather than displace us. I remember when people used to man the toll booths in major highways, and all of a sudden they were displaced and substituted by machines, and there was a big commotion about how there were going to be a significant segment of the population was going to be unemployed because of that. I remember the times, we all remember the times before the internet. And now, if we think of our lives without devices and without access to the internet, we feel depersonalized and derealized and afraid to be able to function effectively or efficiently without our devices and without the agility of communication that that is present now. So to promote, if we look at the impact of psychotherapy as, if we look at the goal as promoting mental health, I think that there is room for all the help that we can need, because every single person in the world could benefit from the salutary effects of psychotherapy. Yes. It's not only the 10 to 20% of the population with psychiatric or psychologic diagnosis according to ICD or DSM or the Chinese classification of disorders. It doesn't matter what classification or nosological classification you use. I think every single person can become more satisfied. Quality of life could be improved. They become more effective, more efficient. Their relationships could improve, as in addition to symptomatic reduction as a result of psychotherapy. So I welcome all of these bridges to expand access, including machine-delivered psychotherapy. There is, I think, a silver lining of the only silver lining I can think of the COVID pandemic is the fact that we all became incredibly comfortable with teletherapy. I mean, right now in New York City, I would say that 20 to 30% of patients attend their individual psychotherapy sessions in person. And the vast majority, 70 to 80%, do so over video or over the telephone. When I began training in psychoanalysis, several decades ago, we weren't even allowed to do phone sessions. At the very beginning, we weren't even allowed to have the patients sit on a chair. They had to be lying on the couch, et cetera, et cetera. So, I think all of these changes, could be understood as expanding access and facilitating access. If I have a patient who works in the financial district and wants to come to my office for a psychotherapy session, it would take that person 45 minutes of commuting on a subway or a taxi, 45 minutes for the session, and then 45 minutes to go back to their office, and then probably 1 hour to get themselves in the right frame of mind to continue in their 12 to 18-hour workday. That is practically, from a practical perspective, impossible. Now what they need to do is close the door to their office and engage in a 45-minute session or a 30-minute session or even a 20-minute session and improve the quality of their lives and their effectiveness. And by doing so, the 2,000 employees under their supervision will also improve their quality of life. I think that all of this is, I see it as very exciting, and I am trying to embrace these technological advances cautiously, but without fear, because we have a tendency to become fearful of anything that's technological, of anything that's new. But we have to remember life before beepers, before telephones, before computers, before cell phones, and how we transition into a state of functioning that, in my opinion, is a higher state of efficiency and effectiveness. I know Dilip has some experience or some knowledge of what's happening, for example, in Japan with robots and being used as companions for people who are lonely. And I'm sure he can talk more about this.
Yeah, Professor Jesse, you want to continue or? Your microphone, Philip, your microphone. Sorry. Yeah,
Yes.
now.
Yeah. Thank you very much. This is really a wonderful discussion and very important one, because I really think that we need to rethink about our role in the society. So right now, what do we do in terms of psychotherapy? Most of us give psychotherapy to some patients, and we train our trainees, medical students, residents in psychotherapy. That's too insufficient. What we need. There are 8 billion people in the world, right? And 20% we agree that have mental illnesses. The prevalence of loneliness in some countries where it has been looked at is about 30%. So talking about so many people that the numbers of physicians or even in the sense psychiatrists, psychologists, even if you look at other medical professionals like nurses or social workers, those numbers are too small to meet the needs of 8 billion people. And I think what we need is to change our role to that of leaders in the field of psychotherapy, in which the therapists go beyond the professionals I talked about. And there are some studies now starting about lay therapists, that you take a lay person and train that person in giving certain type of psychotherapy. For example, compassion-based therapy. In US, the VA, Veterans Administration, they now have studies going on in which the lay veterans, they're trained about how to call a lonely person at least once a week, speak on phone or via Zoom, and try to increase the compassion level. And they actually found that this is working well. Recently, there was a study from Hong Kong in older people, again, using lay therapists. So another kind of therapists, even going beyond that, are people with mental illnesses who have recovered. So they become peers And again, obviously, we can't take most people with mental illnesses if they still have symptoms, but people who are recovered and they are doing well, they actually can contribute to the therapy. So I think our role needs to change from just administering and training a few people in therapy to making psychotherapy a part of the general society where people know that. And obviously, we will need to train people. And again, our trainees will need to train others and so on and so forth. So that number increases. César mentioned about the robots. That's really also an important point. We all accept the fact that artificial intelligence is going to change the world. Artificial intelligence is going to change differently medicine. It has come a long way. Many things we thought the artificial intelligence would never do. That has changed now, especially in the last 3-4 years with the large language models and other developments. And I expect, honestly, that in 10 years, we'll have these robots that César mentioned. And we won't call them robots. I think we can call them avatars or whatever we call them. But they can be therapists. They can do a good job. Again, we'll need to take a lot of ethical and other aspects into account before going there. But I really think it is important that we think about the future in that fashion and start innovating something.
Thank you very much. I think it's very encouraging as also for our young colleagues to see that this panel is encouraging to embrace new things and not just to wait what happens, but how can we shape this also? Because by having only, we know this resistance in therapy is never good. If you have only resistance, things will not happen. So how can we embrace that? I don't know if Gabi or Professor Pritz want to share something to that, or Gabi?
I'm not so enthusiastic about technology and about ChatGPT and artificial intelligence, even if I know that it is the future and it will be. What I believe is that there is a level of psychotherapy where is needed another person in front of the patient. So I think there, at that level, a robot cannot do our work. But what I see in my practice is that we have patients and clients with a lot of education in terms of psychology, psychotherapy, thanks to technology, thanks to ChatGPT and other platforms. We have patients who are more aware about their objective in therapy. They know what they want. They know their needs. And from this perspective, I think that all this technology help us when a client comes with topics or concepts like trauma or borderline or other concepts specific from psychotherapy. This is a point of connection with them. In the same time, can be a point of confusion, and we can work a little bit to differentiate between what the machine said and what a psychotherapist believe. And I think that in the future, our patients will be more and more empowered. We as psychotherapists, we have to be more and more flexible, but the therapeutic relationship is the core of change.
Thank you very much.
And this therapeutic relationship must stay deeply human.
Thank you very much. Professor Pritz, anything you want to add to that, or?
No, I just want to agree what you said. And bringing up one point Professor Alfonso has mentioned, that is that psychotherapy is not only for sick persons, but also for the personal growth, which is beyond that what the social security agencies are defining. And this personal growth, we implemented already in the first psychotherapy law worldwide in 1990 in the Austrian psychotherapy law, that is treatment for ill persons, but also for psychotherapy for personal growth. Was a big debate about that in the 90s, and then it didn't play any more significant role. But what in this context, what we have to think of is the significance of spirituality. We have often, our patients have a lack of spirituality, or they miss it because they feel not understood in this desire. And often the public science says that is nothing, that has nothing to do with science, we don't deal with it. But nevertheless, there is a need, whether we want or not. And the question is how we deal with that in psychotherapy. Personally, I'm not a believer in a God, but I think spirituality plays a role for everyone. This is it.
Thank you very much. Very, very important point, which is emphasized also more and more, especially people from collectivistic cultures. For them, that's a very important part of life. Thank you very much. So, dear colleagues, now we get then to the next big topic. Actually, we are already in it. It is the education and training of psychotherapists.
Yes.
Now, we spoke a little bit what the future psychotherapist should do and know and so on. So maybe based on your experience, you all are engaged in training really psychotherapists, mental health workers. What should we prioritize in the education? What is especially important? You know, maybe what kind of competences you would say especially are needed, or maybe even you could say maybe what you would, based on your experience, say is maybe the most important skill a psychotherapist should have. You know, we have this old thing, they need a lot of self-experience, self-discovery on one hand. Others says, of course, transcultural competency. The other says, I don't know, emotional resilience, but maybe based on your experience, maybe what would be important that we focus on, because today also many trainers are here, other educators. So maybe what do you think we should really, how can we prepare them also for all these tasks we just spoke? I thought maybe, I don't know, maybe Gabi Hum, you can start, and then maybe Alfred Pritz can join, and then we go this round then, based on your experiences in these many countries then.
You know, I'm a promoter of self-discovery and self-experience, and I think this is one of the most important elements. We have to keep an eye on it in our groups when we train people for psychotherapy. And this especially because, as I told you, we are not so many, we have a lot of patients, and it seems that the level of burnout for psychotherapists, compassionate fatigue and other difficulties increased during the last year. So self-discovery could help to take care of us more, and in this way to take care of our clients and patients. Regarding competencies, I'm not quite sure if this is a competency, but I think that is important for all of us to know how to develop a relationship.
Yes.
And I'm not quite sure that this is something we can learn. I still have this question in my mind, even if I train psychotherapy since more than 15 years. If this is trainable or this is something we have from our childhood. What I know is that our students who are a little bit anxious and relationship oriented, they become very good psychotherapists.
Thank you very much. But then it would be a topic for another time. What is self-discovery, or you call it in America personal therapy? Yeah? What is this, and how can we maybe get more out of that then? Professor Pritz, maybe some based on your experience. Yeah.
Concerning the education, Sigmund Freud has defined 3 elements in the 20s, that is self-experience, supervision, and theory. And I think these are still the elements which are needed to educate psychotherapists. But it is very dependent from the countries. There are many countries in Africa, in Asia, especially where there are no educational activities with a curriculum. But there are many seminars on different kinds. In Europe, it's totally different. We have, as I said already, many associations, many different types of methods where one could question which are effective or which are just personally homemade methods. And we have this development with education at universities. And this education at universities, we founded the Sigmund Freud University 20 years ago. This year we celebrate 20 years. So it was an interesting but also a hard experience, because, as you said, it is important to develop the relationship, the ability for relationships, but it's also necessary to have a good knowledge and to implement it in a basic education of human beings. And this was the task to establish a bachelor, a master, and a doctorate. And now it's going on in Germany since a few years. The same, that many, many universities offer psychotherapy training of different kind, mostly behaviorally oriented, but also others. And maybe this is one of the future paths which comes up, to see how university-educated people can be, I say, better psychotherapists than others. It's an open question, but what is out of discussion is that without a significant diploma in psychotherapy, it is hard to have a position in the market. And certainly my university and other universities and other associations try to reach the level 7 compared to professions in the European classification. So I think this is a promising future, but it is certainly a point of hard discussions. Because how much should we, for instance, prove the student that he has understood or she has understood what you have to know about psychopathology, and do you have enough made experience, self-experience, that you know yourself in not harming the patient. And for that, we started an outpatient clinic, which our students can attend in the 5th semester and make experience with a supervisor, so that when they are finished with their studies, they have a teaching therapy, a pack of theory, and a supervised practice. That is on different levels the task.
Thank you very much, Professor Pritz. Professor Alfonso, based on your experience in so many countries, and
Yes.
I know you travel to many associations and so on, then what would you say maybe is the most important skill for psychotherapists, and or what have we to include more in therapy, or more emphasis in our trainings? What should we emphasize more, or what is your
Well,
experience?
let me begin by saying that even though I am trained as a psychoanalyst, and I think like a psychoanalyst. I practice like a general psychiatrist and not as a psychoanalyst. So psychoanalysis has informed my way of thinking. I think that psychoanalysis was perhaps the most important cultural movement of the 20th century that permeated many different fields, including the mental health professions. And there's a lot that should be preserved from that level of creativity from that movement, including the original tripartite model that Professor Pritz endorses and that I endorse, and that is that to become an ideal psychotherapist, the most competent, possibly the most competent psychotherapist, we should have access to three components. One component is classroom teaching. The other component would be the laboratory experience divided in two. One would be the personal therapy, and the third part would be access to a supervisor or a mentor to discuss our cases. It is similar to the scientific model in many universities when, people who want to become chemists, for example, they must have a laboratory experience and they must have the classroom experience, and they also need mentorship and promotion and supervision and that level of encouragement. So it's not a model that came from psychoanalysis without a context. It is based in the scientific methodology and in the scientific context. But I think it is, again, as I mentioned, the ideal exposure that any academic should have to become the best possible psychotherapist. Now we have to learn to do the best we can with the tools that we have. And a reality is that only in the most educationally advanced countries in the world, only 40% of the population graduates from university. So does that mean that we're going to, and these are the top tier countries in the world. So the people who attain a university degree, we're talking, way less than 50% of the general population. Are we saying that psychotherapy should be limited to an elite of people who complete master's level courses or PhD level courses? I think it's an important question when we consider the public health model of delivery of psychotherapy that has been shown to be very effective in countries that are underserved and where there are not enough academics to provide the services, where the experts, the PhD level experts, the master's level experts, basically function as trainers and supervisors. And the actual psychotherapy is delivered by people without the academic level of expertise. So that's one, a large contextual aspect of it. The other is, well, what do we do in places where there are no, let's say, certified psychoanalyst and a young physician or a young psychologist wants to become a psychoanalyst? There are no psychoanalytic institutes. Well, we collaboration with other countries, using the video conferencing, learning tools to be able to train people in different countries. That has been an attempt at bridging that gap. But another component that hasn't been emphasized yet, and I'm surprised to hear that no one has mentioned it, is that we are completely neglecting our ability to provide group psychotherapy and group supervision to reach out more people in the population, both from a training perspective and from psychotherapy delivery perspective. So if in a place where there are not enough therapists or educators to provide the supervision, a group supervision would make sense instead of the traditional one-on-one learning experience of the personal analysis or the personal treatment. You could have a hybrid where you integrate the group experience and you're able to educate more people. Another difficulty and great obstacle of the psychoanalytic movement in terms of promoting the rigorous standards, I think, and the reason that many people are not becoming psychoanalysts like they used to before, is the length of the treatment that perhaps may be excessive. I think that if you take, for example, what many universities are doing, rather than providing certificates, if you want to become a psychoanalyst, you can go to a psychoanalytic institute, you go through many years of training, and then you get a certificate at the end. Well, in some universities now have collaborated with psychoanalytic institutes and provide not only certificates, but master's level degrees or PhD level degrees. So if you do the equivalent of, let's say, 1 year of a certificate course, you may also get a master's degree to put after your signature. And that may be very appealing to people who want to become certified as psychotherapists, rather than just collecting certificates because you take a 1 year course here or a 1 year course there. You have a collection of certificates on your walls, but your identity as a clinician is not recognized in the way that it is recognized if you have a degree attached to your name. And that could happen if we collaborate more with universities and promote our evidence-based psychotherapists so that when people get trained, they not only get certificates, but they also get degrees. And I have learned from experience that sometimes as little as 6 months of training may be sufficient to create expertise in psychotherapy. So even though I come from a tradition where you had to train for 4 to 12 years to become a psychoanalyst, I have witnessed that as little as in many countries that, through educational initiatives, that as little as 6 months of training may be sufficient. And including delivering the training over the internet, video conferencing. So this is my personal opinion. Thanks.
Especially about the connection between postgraduate institutes and the universities, then I think that's a very important thing. Professor Gisti, something you want to add to that point?
Yeah, sure. First of all, I really loved hearing from everybody, and including different thoughts, because that's something I think I want to stress, that the goal of this meeting is not to come up with single solution that everybody will agree. We must come up with different solutions that will apply to different groups. That's why Professor Hum's point about this artificial intelligence not working is actually a good point. We must take that into account. What are the downsides, why it may not work in order to... And so I really think that kind of diversity of opinions is critical. I look at this somewhat from a broader perspective. I started by talking about loneliness, how it has become a universal problem, increasingly common. This goes beyond psychiatric illnesses. So we need a solution that is also universal and that goes beyond specific therapy, right? So is there a vaccine or an antidote for the pandemic of loneliness? Actually, there may be. I call it wisdom. So wisdom is a personality trait with specific components. The most important is compassion, empathy and compassion. Then comes emotional regulation, self-reflection, acceptance of diverse perspectives, and something Professor Pritz mentioned, spirituality. Spirituality is critical. I believe that it is an important component of wisdom. And, also, you talked about social connections. Social connections are very important. The single most important social determinant of health is social connections. Social connections have greater impact on even our mortality than hypertension, diabetes, stroke, you include all of them. Social connections have a greater impact. And this is based on hundreds of studies all over the world, including tens of thousands of people. So there is no question that we really need some broader solution where we focus on wisdom, especially the compassion, emotional regulation, spirituality parts, and also social connection, because compassion improves social connection. Why don't we like one another? Because we have different perspectives. And if we accept the fact that it is okay to have different perspectives, but we can still like people who think differently, that's okay. I think that is essential for today's society to survive. Right now, I see a lot of hatred. We hate, and half of the people think this way, half of the people think other way, and there is no commonality. That's really not good for the human survival. We need something that brings us together and that can have differences of opinion. Again, that's perfectly fine. That's actually good because that is how we improve. But we cannot hate everybody else. We don't have to like everybody else in the world, but we need to have that social connection. Again, as I said, this is based not on psychology, sociology, it is based on biology. Biological studies in animals as well as humans have shown that social connections are associated with improved, for example, it reduces the level of inflammation, reduces the level of allostatic load that is associated with stress, even neurobiological effects. Studies have shown that good social connection increase not just the function, but even structure of the brain in terms of the gray matter volume in prefrontal cortex, certain parts of that. It is associated with the level of social connections we have. There's something called social anomy that people have studied. So my point here is, coming back, that we really need to think even in a broader way, is bringing what we do with loneliness is the social connections and wisdom. And this is something we can train people. Of course, we must train people. We must train our children. We must train the students who go to school and others, our colleagues, because that is what will improve the social connections and reduce loneliness and improve really our well-being and functioning.
Thank you very much. Thank you very much. So thank you very much for this part. I thought that's now a good point to get to some of the questions of the audience. So my team has filtered some of the questions, and now the most difficult are here. I just bring them, and then you can, maybe not all of you have to answer each question, maybe those who want to fill that. Yeah, let's start with, they're all a little bit complex. One is, it's about the societal responsibility of the therapist. They say now, here's the question: what is the therapist's role in society today? With, I don't know, wars and this and that, injustice going on. Must we be professional neutral? This professional morality, yeah? Or
Neutrality.
Morality then, yeah? Or do we have to become, so to say, more political in our work as a therapist? Just give this. I don't know who want to say something to that.
I can say something,
please.
If I may.
Yeah.
I think that we need to encourage activism in the same way that we encourage educational activities. But the reality is that not all clinicians are comfortable in those roles. And some people are more comfortable as being politically involved or being an educator than others. And that doesn't take away from your identity as a clinician. It's just your personal preference or based on your set of skills. I was surprised a while back when I did a survey of medical psychoanalysts in the United States to find out that only 35% of psychoanalysts who are certified psychoanalysts, psychiatrists, were actively involved in education, meaning that the vast majority were clinicians. And my first reaction was almost being offended. It's like, we need more people. I mean, after all of that effort, why not give back as an educator and train others? Well, it may be a matter of personal preference. It may be a matter that people don't have the pedagogical skills, or simply the interest or the time or their life balance is different, and they want to attend to other matters, and that needs to be respected. Having said that, there is an important place for political activism and for psychiatrists, psychologists, mental health professionals of all specialties to work jointly and collaboratively with politicians and diplomats to enhance their skills. You know, in the 1970s, there was an important movement in Washington, D.C., where psychoanalysts were and anthropologists were training diplomats at the Department of State to improve their cultural sensitivity so that they could be better at mediating, you know, complex political situations. We need to encourage that type of collaborative work. I think that the trick is to not to take the weight of the world on our shoulders and to approach it, you know, more from the perspective of teamwork and collaborative work.
Thank you very much. Thank you very much. Then we have a question from India. The colleague asked, how do we define healing in a world that increasingly values performance, productivity, and speed? So, in medicine, healing is sometimes clear. You have an operation and then it's okay. In the mental field, it's a little bit more difficult. So, how can we define healing in today's world? I don't know who maybe want to say something to that.
I think the client is the one who define it's the client, not the patient. So to make a little bit the difference, the client is the one who define its own health and the objective for its own health. And if we look at the balance model we use in positive psychotherapy, balance between the 4 areas of life could be an idea of what healthy means or healing means. If we look at our patients, Professor Peseshkian used to say that a healthy person is not a person without problems, but a person who has the tools to use in order to deal with the problems in life. So maybe from my perspective, this is the definition of what means to heal, to help the client to have the tools he or she needs for dealing with the problems in life.
Good.
Yeah. Professor Pritz, you want to say something, or you agree with that?
No, I totally agree. I thought I'm curious what is the next question.
Yeah, me too. Yeah.
Mrs. Hum did answer precisely.
Okay. The next question, it's difficult. There are actually half of the questions is about artificial intelligence and psychotherapy. It's interesting. That is really, I think, for example, one of the colleagues writes, I have used ChatGPT as my therapist, and it's scary good, I must say then, yeah. So and especially for the young colleagues, I mean, for us now, ChatGPT is 2.5 years. The young colleagues, this will accompany them their whole life. I mean, so it's really the question. So one question in that connection is, what will a therapeutic alliance, we have this therapeutic alliance, what will a therapeutic alliance look like when therapy is hybrid or brief or possibly augmented by technology then? So what is your experience, how this therapeutic relationship changes? Yeah.
We have, during the Corona period, we have started to evaluate online psychotherapy towards person-to-person psychotherapy. And it was quite interesting that the results were very similar, not the same, but very similar. So we could say that online psychotherapy works. And after a while, the Social Security also paid the sessions of online psychotherapy, what was totally forbidden before this crisis. Now it is everyday life of psychotherapists to do online psychotherapy worldwide. And in Austria also, and even the Social Security pays it. So we have a good experience with that. Nevertheless, there are studies who show that the combination of a few sessions in person and then online psychotherapy is very good. I don't know a comparison, but I know results of these procedures. A few personal sessions and then online psychotherapy. That is not always possible when there is online psychotherapy over long distances. So, but in short, we can say that online psychotherapy is effective.
Another question from Victoria from Ukraine, a general question, but what do you think? Should the basics of psychotherapy not be introduced as a subject in schools? I think it's, I don't know, relationship, communication, whatever, and so then, yeah. So what do you think? I mean, I'm not sure if we can decide this now at that field, but on the other hand, if we don't do something, nothing will happen. So what do you think? Should the basics maybe be taught at schools? And
maybe I can answer in short. Carl Rogers was writing a book, Learning in Freedom, 60 or 70 years ago. And this book I can recommend because he answers clearly that it would be a great help for the teachers to have some basic courses in psychotherapy.
For the teachers, okay. Professor Jesse, you wanted to say something or about?
Yeah, no, thank you. Sure. No, I believe that this is actually an important question in the sense, what do we teach our kids? And I find that the problem with the society is that we focus too much on hard skills. So for students, for example, reading, writing, arithmetic, we always say that those are the most important ones. And whom do we award? We award the champions in this particular, for example, tennis champion who defeated everybody else. So focusing on those skills, I think we need to go beyond that. And what we need to do is not just those skills, but compassion, empathy, compassion, emotional regulation, self-reflection, spirituality. Those are the things we need actually for happy living, well-being. And this is not something new. I mean, since the times of Aristotle, this has been known that we need eudaimonic well-being, not just hedonic well-being where we make more money and we are happy. No, that doesn't make us happy. It is actually more having a purpose in life, having good social connection with others, where we like others and others like us. Not everybody, but at least many people. And where we are happy, and we do something that makes us feel good. So I think that is something, again, that is wisdom. And teaching of wisdom, I think, is critical at all levels. I mean, the parents should do that for their kids. Definitely the teacher should do that, and we should award that. In the sense, we should not have just award for who beat all the other tennis players, but also award for sportsmanship. Why don't we reward sportsmanship, right? I mean, that's so important for well-being of everybody, including the people who lost. I think that is what is needed for the society. And if we do that, that is going to bring down loneliness, this hatred, and all of those things that are happening.
I think so far, I think as a conclusion from that, what we discussed the last hour is really the therapist has to get, so to say, with one leg, he must be in the therapy room, but with the other, he has to get out. There are so many things and responsibilities because we have so many insights. I mean, if you want or not, we have insights in human life, human suffering, and many things. So we have to get out of the room then.
May I ask
please, yes,
something here? Because you said second time now that we are staying inside our office and patients come. Why we are not going out? We to go to our patients. We to go in schools. We to go to, I don't know, communities and to work with them, to talk with them, to teach them more than we already do, because I also believe that a lot of us, we are staying in our offices and we are working with one person per hour.
Which might be also because most psychotherapy methods, as we know now, come from Western countries. So the individualistic concept has influenced. Of course, there are older traditions in China and Asia and so on, but that's what Professor Alfonso said with the group therapy, group training and so on, then this is something which we have to
And we have to, sorry.
No, I was going to follow up on that. Let's not forget that group psychotherapy originated at the beginning of the 20th century, just a few years after individual psychotherapy took off in Freud's Vienna. In the early 1900s, there were internists in Massachusetts providing group psychotherapy to tuberculosis patients. The original intent of those doctors was to educate patients on respiratory hygiene because there were no effective treatments for tuberculosis. And what ended up happening is that patients did not want to be educated about respiratory hygiene. They wanted to talk about their feelings. So Dr. Pratt, the person who invented group psychotherapy, listened to the patients in the same way that Freud listened to the patients when a patient said, well, why don't you let me free associate and say whatever it is on my mind? And that became, an essential method of psychoanalysis and psychodynamic psychotherapy. So, we have had these traditions that we're not capitalizing on them to reach more individuals. To go back to if I may, to the issue in artificial, the fear that machines are going to dehumanize our field, and that I think that if we take more of a dimensional approach rather than a categorical approach, a categorical approach would be humans are much better than machines. I mean, it's hard to argue with that. But a dimensional approach would be something similar to what I do in my practice. When I have I do a new evaluation, I tell my patients the first visit must be in person. There's no questioning of that. And it's going to be a 60 to 90-minute evaluation over 1 day or 2 days. After that, depending on your level of comfort, your schedule, my schedule, we may switch to video at some point. And that works very well. At the age of 2, we know this from psychoanalytic tradition, we develop the capacity to internalize the presence of the other. We don't need to be in the same room with the parent, not to fear that the parent will disintegrate if they're outside of our field of vision. So we can use the telephone, we can use video. Now with video, we can actually appreciate facial expression much better than when you're seated 1 meter, 2 meters away from your patient. In an office setting, you may be able to appreciate the kinetics and the entire body movement and that aspect of communication. But with video, we can look at the nuances of facial expression and capitalize on that. So there are pros and cons to all of this. And I think that, taking a dimensional approach will make us less fearful and allow us to embrace technology as a way to enhance our practice, not necessarily to displace being with our patients in person, in the office or outside of the office.
Thank you very much. Thank you very much. So, dear colleagues, then this brings us to the final round now here. And I thought maybe to end this thing with just one question, and then I think that would be interesting also for our colleagues, and when we have a little bit time maybe to elaborate on that. I know in psychotherapy we should not give advice, but sometimes we do. Yeah. So what would be your advice in a positive way for our younger colleagues on the path of becoming a psychotherapist, or maybe they are young professionals in that field? So what would be, based on your life and professional experience now, what would be like the best advice you have for someone? What, I don't know, what they should do, what they should not do, maybe then, maybe advice, if you would have gotten this advice in your early career, your life would have been different. I don't know, maybe something you want to share. I thought that's maybe a good, and so we have then now some time, you can share anything you feel would be important on that, please.
Maybe I can say something.
Yeah.
So this relates to also the question that came earlier about healing. So we have to remember this, the modern definition of health is not just physical health, physical, behavioral, spiritual, and socioeconomic well-being as defined by the people themselves. And by the way, this is something that is in the report by the National Academies of Sciences, Engineering, and Medicine that was published a couple of years ago. So it's the official US definition. That makes a lot of sense. And that is where the well-being and healing sort of comes into play. And that is important for advice. So when we give advice, I mean, I personally think that in most cases, it should not be our telling that you do this thing and don't do that. I don't think that's really a good purpose of psychotherapy. But we should say the pluses and minuses of what will happen if you do this versus that. And clearly, I don't think there is anything wrong in our saying what we prefer or what we like. Again, it depends on the way we address the patient's needs. A young kid, for example, would need a more specific advice than an older person who has seen all of that. So briefly answer the question again, is that I don't think in most cases we should give direct advice that no, you do this and don't do that. But we present different options and the pluses and minuses. At the same time, there is nothing wrong in our indicating preference for something. Let me stop there.
Thank you very much.
I continue.
Please.
I would have a practical advice, the first one. The first one is to learn one method of psychotherapy, to have their own structure of intervention, and during their development path to add some other techniques from different methods in such a way that in the end to be able to adapt their intervention to the needs of the client. Because what I think is that psychotherapy, maybe not only in the future, I think it starts now already to be a mosaic of interventions which needs empathy, ethics, and development, evolution. So this is one advice. The second advice is to take care of them. We can do psychotherapy if we meet someone in a forest or on the road, in the airport, on the way to holiday. But we need something. We need to be healthy emotionally and mentally. This is the unique tool we need in our profession.
So you mean to set boundaries and that
Set boundaries.
If somebody comes at the
Do
airport, then they need to-
self-therapy time to time, to go for supervision time to time, even if they have experience in this field.
Thank you very much.
I would add that to a piece of advice to enhance our own, to create fortitude and prevent burnout and moral injury. A shortcut to that would be to place a lot of effort on being highly socialized. Our field is designed in a way that we tend to isolate. We tend to listen more than to interact actively with others. We need to, outside of the clinical setting, make an effort to, in ourselves, and also encourage our patients to recognize the importance of being connected, to have a network, and of the importance of socialization in ways that are meaningful. That is, in my opinion, more important. Improvement in the quality of our relationships and also in the quantity of our relationships is more important than symptomatic reduction. If you ask a patient who successfully completed a treatment, a psychotherapy treatment, how has your life changed? They're not going to talk about reduction of the number of panic attacks or, I'm sleeping better. They're going to talk about how their relationships are so much more meaningful and their connection to others then leads to a higher level of happiness. Now, specific advice in terms of how fragmented or diverse, depending on how you look at our field is, there are at least 1,000 psychotherapists out there. Of those, at least 500 have sufficient scientific evidence base. None of us is skilled in more than a dozen of those psychotherapies. It doesn't matter how hard you try. You're not going to become an expert in more than 10 or 12 different types of psychotherapy. So yes, it is important to find one that appeals to you the most and pursue that, like Abby said. But I also think in terms of research questions, it is important for us to begin to look with more emphasis at what are the curative factors that are the same, that are common in all of those psychotherapies. And Carl Rogers began to identify them, decades ago. And some of them are quite obvious to us, like expression of emotion and the importance of the therapeutic alliance. But others are a little bit more subtle, like, for example, the psychoanalytic concept of mentalization. Our ability to become more fluent with the language of emotions and understanding that emotions drive our actions and our actions impact the emotions of others, and then they drive the actions of others, and that we call a relationship. That process of mentalization is an important psychoanalytic concept. It's related to higher levels of socializing, and it's what we do with our most difficult patients. They're patients with personality disorders and complex comorbidities. So, the mentalization, empathy, the therapeutic alliance, expression of emotion, I would say those are the core curative factors of all psychotherapy. So when you're feeling this, so when you're a beginning psychotherapist or not so experienced, or you're an experienced psychotherapist, but you're feeling insecure in terms of your patient not progressing at the rate that you think they should be progressing, look at those elements and make sure that your treatment is addressing those important core common concepts. Thank you.
Thank you very much. Thank you very much. Professor Pritz.
I agree totally with Professor Alfonso. Just want to stress out 2 points which have been already mentioned. That is, the ability to listen can be trained. Also, Mrs. Hum doubted that maybe it is something we have from childhood, but nevertheless, it can be trained. And the second point is also mentioned by Professor Jeste, that is empathy, or he called it compassion, a concept of the Dalai Lama, by the way. I think this empathy and compassion is something very, very important. And those who are for some war activities, it's said to them, you lose compassion. You lose the ability to understand the other. And I think psychotherapists should do that.
So, dear colleagues and friends, thank you very much, I think, for a very interesting discussion. I mean, I wrote down many things for myself here, many interesting points to really think about that. And I think also on your behalf to thank very much our 4 panelists, Gabriela Hum, Dilip Jesti, César, Alfonso, and Alfred Pritz, really for taking the time, for accepting the invitation, and for sharing really in the short time, really some of your insights. And I think this, at least for me, I think it's such a meeting is very motivating, and to be in this profession. It is in some aspects not like many other professions, yeah. And it is a special profession. We are there. This from Freud, where he said it's an impossible profession, yeah. And really, it's yeah. So we are here, and I think that we are the possibility that we can think what we can do with the skills we have and these insights. Many other professions, they cannot do that. What should the poor engineer do? We can sit here and we have a luxury problem on one hand. Yeah, so we have a lot of patients, they need that. We have to go into prevention. We have to go to schools. We have to work with teachers, with parents, with politicians, and to share these insights. I mean, that's wonderful. But at the same time, we have to keep our own balance, that we sometimes meet some normal people who are maybe not psychotherapists, who we can just be together and who help us to ground us, I think, a little bit then. So thank you very much, really, for this very inspiring panel then, yeah, and which also we are using technology in order to make this possible, yeah. So really, thank you very much for you to attend. Thank you for the participants, and thank you also for our translators. There are 6 of them. You don't see them now. They are sitting there and translating simultaneously now all this thing in different languages. Thank you for that. This helps us to really share these experiences from different countries and go back home with these ideas and be motivated for whatever we do to really make this world a better place. And the present situation shows everywhere in the world that this profession really is needed, or these insights, but these insights are needed, and we have to get them to more people. And thank you very much for the team to making this, to all these technical arrangements. So it's exactly 4:30 German time. So thank you very much, all of you, and those who participate in the general events of today. I think now we have a break of 15 minutes, and then you go to your national online conferences and so on. Then, and in the evening back here. Then. So thank you very much. Thank you to the
Thank
panelists.
you.